New York is preparing to ration its ventilators for sick coronavirus patients as a major disaster was declared in the city as it struggles to cope with the deadly outbreak. The disaster declaration comes as New York prepares guidance on how to deploy vital ventilators amid a widespread shortage of key equipment that also includes masks and surgical gloves, and medical supplies such as blood. The draft guidance on ventilators, prepared by a state taskforce in 2015 for a possible influenza pandemic, has reportedly been updated for the coronavirus crisis, according to the Wall Street Journal. According to Sam Gorovitz, a professor of philosophy at Syracuse University and member of the taskforce, the revisions to the ventilator allocation guidelines include the formation of designated triage committees to determine which critically ill patients will or will not receive life-supporting respiration. Gorovitz told the Journal that doctors will be required to make tragic decisions on who will have access, or for patients whose prospects are essentially hopeless, will have to be removed to make room for somebody whose prospects are very much better. The Trump administration late Friday issued a major disaster declaration for New York, the center of the U.S. coronavirus outbreak, as infections spike across New York City to 5,000 as one person an hour dies from the coronavirus. The emergency declaration was issued by the Federal Emergency Management Agency (FEMA) to allow the state to access billions of dollars in aid from the Disaster Relief Fund, as the number of confirmed New York cases soar. With no time to waste, the administration heeded the call and approved the nation's first major disaster declaration in response to the coronavirus, right here in New York, Senate Minority Leader Chuck Schumer said in a statement. With more and more cases confirmed here each day, it's imperative that the federal government does everything within its power to stem the spread of the deadly coronavirus. The disaster declaration allows for the U.S. military to be called in, and the U.S. Army Corps of Engineers may take over hotels, sports arenas, college dormitories and other buildings as needed. Under the declaration, FEMA will be authorized to send its personnel and resources to set up mobile coronavirus testing centers, disinfect public facilities, and provide the state with medical supplies that are in high demand such as masks, gloves and surgical gowns. The vast Jacob Javits Convention Center on the west side of Manhattan could be used as a makeshift hospital, state officials have said. New Yorkers are already living under shutdown conditions that from Sunday night will see all residents, except for certain vital professions, expected to stay at home. Only a few vital businesses, like supermarkets and pharmacies, will remain open, and citizens will be asked to only venture outside on vital tasks and not in groups. On Friday, New York Mayor Bill de Blasio said, "We constitute 30% of the cases in the U.S. and 70% of the cases in New York State. Whether we like it or not, we are the epicenter. New York certainly needs help. It has become the main focus of the epidemic in the U.S., outstripping the original hot zone of Washington state. New York State has about 6,000 intensive care unit ventilators, and state health officials fear the pandemic will overwhelm the roughly 3,000 ICU beds available." With cases of coronavirus in the state spiking from around 800 to 8,000 in a week, Andrew Cuomo, New York's governor, has estimated that the state may require 30,000 ventilators to meet demand. Related, New York, now the center of the U.S. coronavirus crisis, can it cope? It's ventilators, ventilators, ventilators. That is the greatest need, Cuomo told reporters on Friday after ordering a statewide shutdown of non-essential businesses. He also directed health facilities to turn over any non-essential ventilators to the Department of Health. "We will purchase it from you if you could lend it to us. But we need ventilators, and anyone who has them now, please call the New York State Department of Health," he said. Warnings of a ventilator shortage comes 2 days after Trump invoked wartime powers to harness private business to slow the spread of coronavirus to a manageable infection curve. But in New York and other major metropolitan areas, a shortage of basic masks and scrubs is threatening the effort even as testing ramps up. In Los Angeles, health officials are instructing doctors to only test sick people if a diagnosis would change how they would be treated, according to the LA Times. The LA Times reports that the county health department sent a letter to doctors this week saying they should only administer tests if a diagnostic result will change clinical management or inform public health response. The decision is part of a shift from a strategy of case containment to slowing disease transmission and averting excess morbidity and mortality, according to the paper.